Sex in nursing homes. Yeah, we're going there. I'm Dr. Nicole Diddick, and I'm a geriatrician who's been in practice for over 20 years. What do you think of when I say sex in nursing homes? In Canada, we call them long-term care homes, but they are also referred to as skilled nursing facilities. They're places where a lot of older adults live. And usually people go to live there because they have some disability. But just because someone's living in long-term care doesn't mean that they're not sexual beings and that sex doesn't take place there. Now, when you think of sex and nursing homes, probably a couple of different things come to mind. One might be that it's a non-issue. So why are we talking about it? And yeah, I mean, when we think about long-term care homes or nursing homes, we probably think that people sort of have their own beds, they're single beds, they're like those hospital beds. So there really isn't room for someone to share. And there's lots of people around all the time. There's nurses going in and out. The rooms aren't really private. Oftentimes there's not really a lock on the door. And so it's hard to imagine that sex would take place in that setting. And we also probably often think that people living there aren't really sexual beings. They're kind of more asexual. The other side of the coin, and one of the main reasons that I get asked to see older adults in long-term care about a sex issue, is when there is an inappropriate sexual behavior. So that's often when I'm told about somebody who is using sex talk, someone who's doing some inappropriate touching, either of themselves or of another person, or there might be a relationship, a sexual relationship that's developed that is seen as problematic. So it's really those two sides of the coin. One is that people are asexual and it's not an issue, or that it's a problematic issue and we have to sort of medicalize it and intervene to just stop it. But the truth about sex in long-term care is probably somewhere in the middle. And sure, those two extremes could be a part of the picture, but oftentimes there is something that is more relatable in terms of just being a regular sex life, that just because it's in a long-term care home, it should go ahead and happen naturally, or as naturally as possible. So I want to define a couple of things first of all, and I do want to start by saying that long-term care homes are homes. And if we look, for example, at the province where I practice, the Ontario Long-Term Care Home Act, it's kind of implicit in that act that people should be allowed to do what they want in their homes. It is their home and they should have dignity, autonomy, and respect there. So it doesn't specifically talk about sex, but I think it's implied that you should be able to express that part of yourself in your own home. There's also very clear legislation about what constitutes sexual abuse in a long-term care setting. And so thankfully, sexual abuse, as far as we can tell, is very rare in long-term care homes. And it's probably occurs in about 1% to 2% of all types of abuse in long-term care homes. So, that's nonetheless very serious, but it's not really what we're going to talk about in this video today. When we talk about sexual contact of any type, though, for anyone of any age, it has to be consensual. Consensual sexual activity is allowed, but if there isn't consent, then that's against the law. So it's in the criminal code. If someone is having sex with somebody else and there isn't any consent, then that would be a criminal matter. And the other thing is that nobody can consent on behalf of another person for sexual activity. So if somebody is living with dementia and they are not able to consent to sex, their partner or substitute decision maker isn't allowed to consent on their behalf. So the consent issue is something that really comes into the forefront when we're talking about sex in long-term care. So just so that we're all on the same page, let's define sex and let's define inappropriate sexual behavior. So that might sound funny to say let's define sex, but if we look at, unfortunately we do have to kind of look at it through a bit of a therapeutic and medicalized lens. But when we're talking about sexual activity in a long-term care setting, for example, we usually think about it as what the act is and who's involved in it. So is it language? Is it touching? Is it sort of implied sexual activity, so the use of pornography or something like that? And is it one person or two? Is their body parts exposed or not? It's often helpful to get a bit descriptive when it comes to sex. But that's the whole ball of wax, right? It's not just tab A going into slot B. There's kind of that whole range of what we would consider to be part of sexual expression. An inappropriate sexual behavior, though, especially when we think about it in the context of dementia, and that's honestly, in my work, that's really, when we say ISB or inappropriate sexual behavior, it's usually as part of a responsive behavior of dementia. So that is a behavior that is problematic or disruptive. So it could be that it's not appropriate for the context in which it's happening. And the context is really important because it could be something that's completely normal, a completely normal part of sexual expression like masturbation or something like that, but it's done at the wrong time or in the wrong place or with the wrong person. So that is an inappropriate sexual behavior. And I think it's really important to define that from the outset. So especially in my work, if I get called in, again, because of some kind of issue that relates to sex in a long-term care home or somewhere else, it's really important to start by figuring out if it's inappropriate or not. Sexual expression is a part of all of our lives, and it is something that is a part of human rights. The World Health Organization has a working definition of the right to sexual expression. And I'll show you that here. So bearing that in mind, we can't just sort of say that it's something that's not important to address, even if somebody is living with a disability or living in a long-term care home. And remember, I mentioned that consent is very important. And disability legislation actually assumes consent. So we always assume that a person is capable to do something or to make a decision, and then we look for evidence to the contrary. Now let's go back to that issue of consent for a moment and talk about how and why that's often tricky when it comes to people living in long-term care. Dementia, or major neurocognitive disorder, and Alzheimer's is the most common type of that. It's not a normal part of aging, but it's more common as people get older. And those living in long-term care are very frequently affected by cognitive impairment. So 2/3 to 70% of people in long-term care are living with dementia. And dementia can affect a person's ability to navigate their sexual expression safely. If we look at Alzheimer's disease, for example, that affects things like short-term memory. So somebody might forget their age, or they might forget their marital status. So they might not be able to recognize their partner, or recognize that somebody isn't their partner, or recognize the setting and the place where they're initiating an activity. And so that could lead to challenges, as you can imagine. When the frontotemporal lobes are affected, there are other changes that can happen, and apathy is one that's quite common. That can happen with Alzheimer's as well. And apathy is often, when it comes to sex, is often a problem for someone who has a partner, because with the apathy, there can be a loss of interest in a lot of things, including sex. With frontotemporal changes as well, there can be disinhibition. So things that people probably would have filtered out before, now that filter is gone. So if they would have previously thought about giving somebody a pat on the bum, but they wouldn't do it because they know it's not right, well, with that filter gone, they would probably go ahead and act on it. And those are biological changes related to dementia. There are all kinds of other things that can affect sexual expression as well. The person's culture, their cohort. So a very vivid case that sticks in my mind is a man who was a retired salesman, and he was always using sexual talk and referring to women, talking about their body parts, calling them broads, touching people, like often not really touching their breasts or anything, but touching their arms, touching their shoulders, like just getting in people's space. And that was his way of relating to people when he was in his working life, right? If you've ever seen the show Mad Men, he was kind of like one of those guys where he would take his secretary out for lunch and maybe she would be on the dessert menu. And that was kind of at the time, that was just how he rolled. So that was his way of swaggering around in the office and kind of, expressing his personality. And for whatever reason, now that he's living with dementia in long-term care, those things are coming out again. So it's really important to get to know the person as much as possible when there's a sexual expression to kind of understand where it's coming from.